So your reproductive systems. Our sexual reproduction requires two-parent organisms, a male and female, each of which contributes half of the nuclear chromosomes that are needed to form the first cell of an offspring organism. Asexual reproduction, on the other hand, will require only one parent who produces an offspring genetically identical to itself. The reproductive system of each parent will produce the sex or reproductive cells called gametes that are needed to form the offspring. These gametes, called an ovum for the female and a sperm for the male, those will fuse together during the process of fertilization. The new offspring cell that results is called your zygote. And after many complicated and amazing developmental stages, your zygote ultimately develops into a new individual organism. Although the organs and specific functions of the male and female reproductive systems are discussed separately, it is important to understand that the similarities in general structure and function can be identified between the systems in both sexes. However, both sexes will contribute in uniquely important ways to overall reproductive success. In both men and women, the organs of the reproductive system will be adapted for the specific sequence of functions that permit the development of sperm or ova and deliver the sperm to the female reproductive tract and your ovum. Then you're in successful fertilization, normal development, and the birth of your baby. In addition, the production of hormones that permit development of secondary sex characteristics, such as your breast development in women and your beard growth in men, those will occur as a result of normal reproductive system activity. The essential organs of the reproductive system in the men, or in men and women, are both called the gonads. The gonads of men will consist of a pair of main sex glands called the testes, and these testes will produce the main sex cells, the spermatozoa, and then the testes will also produce the hormone testosterone. The accessory organ of the reproduction in men consists of the following structures. You have a series of passageways or ducts that carry the sperm from your testes to the exterior, an additional sex gland that provides secretions that protect and nurture the sperm, and then the external reproductive organs called the external genitals. The paired testes of men, those are again going to be the gonads. They are located in the pouch-like scrotum, which is suspended outside of the body cavity below the penis. This exposed location will provide an environment about 1 to 3 degrees cooler than normal body temperature, which is an important requirement for the normal production and survival of sperm. Each testes is a small oval gland about 1.5 inch long and 1 inch wide. And the testes is shaped like an egg that has been flattened slightly from side to side. Each testes is covered by a tough whitish membrane called tunica albuginea, which covers the testicle and has inward extensions that form or partitions that divide the testes into sections or lobules. Each of those lobules will include a narrow but long coiled seminiferous tubule, and these coiled tubules will form the bulk of the testicular tissue mass. Small endocrine cells lying just outside of the tubules are called interstitial cells, which will secrete the male sex hormone testosterone. Each seminiferous tubule is a long duct with a central passageway in which sperm develops within the walls and then are released into the lumen and begin their journey to the exterior of the body. Sperm production, that is called spermatogenesis. So from puberty on, the seminiferous tubules will continuously form your spermatozoa. Although the number of sperm that are produced each day diminishes with an increasing age, most men continue to produce significant numbers through life. The testes prepare for sperm production before puberty by increasing numbers of sperm precursor or stem cells called spermatogonia. These cells are located near the outer edge of each of the seminiferous tubules along the inside of the basement membrane. At puberty, the spermatogonia will increase in number by the process of mitotic cell division. We talked about it previously, but the mitosis results in the division of parent cells into two daughter cells, which identical to each parent, and then each are going to contain a complete copy of the genetic material that's represented in the normal number of your 46 chromosomes. The head of the sperm will contain the nucleus, which is the genetic material from the father. The sperm head is going to be covered by a chromosome, or acrosome. Sorry, I don't know why that one's always hard for me to say. By the acrosome, which is a cap-like structure that contains enzymes that enable the sperm to break down the covering of the ovum, and it permits entry if any contact occurs. In addition to the head with its covering of acrosome, each sperm has a midpiece and an elongated tail. Your mitochondria in the midpiece will release adenosine triphosphate, or ATP, and to provide an energy source for the tail movements, which is required to propel the sperm and allow them to swim for relatively long distances through the female reproductive ducts. In addition to spermatogenesis, the testes also function as an endocrine organ and secretes your male hormone testosterone. This function is carried out by the interstitial cells that lie just outside the seminiferous tubules of the testes. Your hypothalamic secretion of GnRH that causes the anterior pituitary to secrete LH, which stimulates the interstitial cells of your interstitial cells to secrete your testosterone. Testosterone is going to masculinize, so the various characteristics that we think of as male will develop because of testosterone's influence. So for instance, when a young boy's voice deepens at puberty, it is the testosterone that brings this about. Testosterone promotes and maintains the development of male accessory organs, such as the prostate glands and your seminal vesicles. And then it also has a stimulating effect on protein anabolism, and it is an anabolic steroid hormone. So testosterone, therefore, is responsible for the muscular development and strength that is typical of the adult male. A good way to remember testosterone's function is to think of it as the masculizing hormone and the anabolic hormone. The ducts that provide the pathway for sperm to pass after exiting each of the testes to the exterior of the body are going to be important components of the accessory reproductive structures. The other two components that are included in the listing of accessory reproduction in the male, the supportive sex glands and the external genitals, are going to be discussed separately. Each epididymis is going to consist of a single and very tightly coiled tube about 20 feet in length. It is a comma-shaped structure that lies along the top and behind the testes inside the scrotum. Sperm will mature and develop their ability to move or swim as they are temporarily stored within that epididymis. Specialized epithelial cells that are lining the epididymis will secrete nutrients for the maturing sperm, and it will also remove substantial amounts of excess testicular fluid, thereby concentrating the sperm cell. The vas deferens, that's going to be the tube that permits the sperm to exit from the epididymis and pass from the scrotal sac upward into the abdominal cavity. Each of those vas deferens is a thick, smooth, very muscular and movable tube that can easily be felt or palpitated through the thick skin of the scrotal wall. It passes through the inguinal canal into the abdominal cavity as part of the spermatic cord and a connective tissue sheath that also encloses your blood vessels and nerves. Once in the abdominal cavity, the vas deferens will extend over the top and down the posterior surface of the bladder, where it will then join the duct from the seminal vesicle to form the ejaculatory duct. The ejaculatory duct will pass through the substance of the prostate gland, and it permits the sperm to empty into the urethra, which will then eventually pass through the penis and opens to the exterior through the exterior urinary meatus. The term semen or seminal fluid, that's going to be used to describe the mixture of sex cells that are produced by the testes and secretions of the accessory sex glands. The accessory sex glands, which contribute about 95% of the secretions to the gelatinous fluid part of semen, those will include the 2 seminal vesicles, 1 prostate gland, and 2 bulbourethral glands, also known as your Cowper's glands. In addition to the production of sperm, the seminiferous tubules of the testes contribute somewhat less than 5% of the seminal fluid volume. Usually 3 to 5 milliliters, or roughly 1 teaspoon of semen, is ejaculated at one time, and each milliliter normally contains about 100 million sperm. These numbers vary considerably in healthy men, even from day to day. The paired seminal vesicles are going to be elongated endocrine glands that join the vas deferens at the ejaculatory tract, and together the seminal vesicles are going to contribute about 60% of the seminal fluid volume. Their secretions are often slightly yellowish, thick, and rich in the sugar fructose. This fraction of the seminal fluid helps provide a source of energy for your highly motile sperm. And then your prostate gland will lie just below the bladder, and it's going to be shaped like a donut. The urethra will pass through the center of the prostate before traversing to the penis to the end at the external urinary meatus. The prostate secretes a thick milk-colored fluid that constitutes about 30% of the total seminal fluid volume. And this fraction of the ejaculate will help activate the sperm and maintain their mobility. Each of the bulbourethral glands, those will resemble a pea in size and shape. They are located just below the prostate gland and empty their secretions into the penile portion of the urethra. And because the bulbourethral secretion is often released just before most of the rest of the semen is ejaculated, it is sometimes called your pre-ejaculate. The mucus-like secretions of the bulbourethral glands will serve several different functions. They neutralize any residue of sperm damaging acidic urine within the urethra. They also lubricate the urethra in order to protect sperm from friction damage and add to the external lubrication of the penis that's needed for intercourse. The bulbourethral glands will contribute less than 5% of the seminal fluid volume that's ejaculated from the urethra. The penis and scrotum, those will constitute the external male reproductive organs, sometimes called the genitals or the genitalia. The penis is the organ that, when made stiff and erect by filling of its spongy or erectile tissue components with blood during your sexual arousal, it can enter and deposit sperm in the vagina during intercourse. The penis has 3 separate columns of erectile tissue within its shaft. 1 column of corpus spongiosum, which surrounds the urethra, and then you have 2 columns of corpus cavernosa, which lie dorsally. At the distal end of the shaft of the penis is the enlarged glans penis, or more simply put, the glans. The external urinary meatus is the opening of the urethra at the top of the glans, and the sensitive skin at the distal end of the penis is folded doubly to form a loose-fitting retractable collar around the gland called the foreskin or the prepuce. If the foreskin fits too tightly around the glands, then a circumcision is usually performed to prevent irritation. Most circumcisions are elective, and it can be performed for other medical reasons, such as reduction in the spread of AIDS and other STIs. So here's just some word roots that we have for our male reproductive system. Most of them will run pretty similar with the term, but you have your orchio, that is for your testes, osteo, which is for the scrotum, vaso is for the ductus deferens or the vas deferens. Your vesiculo is for your seminal vesicle, and then prostato is for prostate. For your female reproductive system, the structural plan of the reproductive system in both sexes, again, is similar, and the organs are going to be characterized as essential or accessory. So your essential organs of the reproductive system in women are going to be the gonads, which are the paired ovaries. The female sex cells or ova are going to be produced within the ovaries, and those will produce the hormones estrogen and progesterone. The accessory organs are going to be organs are reproduction in women are going to consist of a series of ducts or modified duct structures that extend from near the ovaries to the exterior. Additional sex glands, including your mammary glands, which have an important reproductive function only in women, and then the external reproductive organs or your external genitals. The paired ovaries are going to be the gonads for your women. They have a puckered, uneven surface weighing about each 3 grams. The ovaries resemble large almonds in size and shape. They are going to be attached to ligaments in the pelvic cavity on each side of the uterus. Embedded in a connective tissue matrix just below the outer layer of each ovary in a newborn baby girl, you have about 1 million ovarian follicles. Each follicle contains an oocyte, which is an immune female sex cell. And at puberty and under stimulation of FSH, an anterior pituitary gland hormone, then a small group of follicles develop into primary follicles, which are going to be surrounded by a layer of cuboidal cells that are sometimes called your follicular cells. During the reproductive lifetime of a woman, only about 350 to 500 of the primary follicles will fully develop into mature follicles. It is those mature follicles that will release an ovum for potential fertilization, which is the process called ovulation. Follicles that do not fully mature will degenerate and are reabsorbed into their ovarian tissue. The mature follicle is often called Graafian follicle in honor of the Dutch anatomist Reinier de Graaf, who discovered it almost 300 years ago. After ovulation, then the ruptured follicle is transformed into a hormone-secreting follicle structure called the corpus luteum. The production of female gametes or sex cells, that's called oogenesis, and the unusual form of cell division that results in sperm formation or meiosis is also responsible for development of an ova. During the developmental phases that are experienced by the female sex cell from its earliest stages to just after fertilization, you have 2 meiotic divisions that occur. As a result of meiosis in the female sex cell, the number of chromosomes is reduced equally in each daughter to half the number that are found in other body cells. The second major function of the ovary, in addition to your oogenesis, is going to be the secretion of the sex hormones, estrogen and progesterone. Hormone production is in the ovary that begins at puberty with the cyclic development and maturation of your ovum. The granulosa cells around the oocyte and the growing and mature follicles, those will secrete estrogens. The corpus luteum, which develops after ovulation, will chiefly secrete progesterone, but also some estrogen. So estrogen is the sex hormone that causes the development and maintenance of the female secondary sex characteristics and stimulates your growth of the epithelial cells that are lining the uterus. Your estrogen is going to be responsible for development and maturation of the female reproductive organs, the appearance of pubic hair and breast development of your female body contours by deposition of fat below the surface, and then in the breast and your hip region, and then also within the initiation of the first menstrual cycle. Progesterone is going to be produced by the corpus luteum, which is a glandular structure that develops from a follicle that has just relieved an ovum. So if it's stimulated by the appropriate anterior pituitary hormone, then the corpus luteum produces progesterone for about 11 days after ovulation. Progesterone will stimulate proliferation and vascularization of the epithelial lining of the uterus, and it acts with estrogen to initiate the menstrual cycle in girls entering puberty. The reproductive ducts in the male and female reproductive tract are similar in some of your fundamental ways. First, both of those ducts will lead from each of the paired gonads and then join into a single passageway that leads out of the body. And second, both female and male ducts will carry gametes away from the gonads. Your two uterine tubes, also called the fallopian tubes or the oviducts, those serve as ducts for the ovaries, even though they are not attached to them. The outer end of each tube terminates in an expanded funnel-shaped structure that has fringe-like projections called fimbriae along its edge. This part of the tube curves over the tube or over the top of each one of the ovaries and opens into the abdominal cavity. In the inner end of each tube, it attaches to the uterus, and then the cavity inside of the tube opens into the cavity into the uterus. Each tube is about 4 inches in length, and after ovulation is discharged, the discharged ovum briefly enters the abdominal cavity, and then it enters the uterine tube that's assisted by the wave-like movement of the fimbriae and the beating of the cilia on their surface. After it's in the tube, the ovum begins the journey to the uterus. Some ova, however, never find their way into the oviduct and remain in the abdominal cavity where they are then reabsorbed. The mucosal lining of the uterine tubes is directly continuous with the lining of the abdominal cavity on one end and with the lining of the uterus and the vagina on the other. This is of great clinical significance because of infections of the vagina and the uterus, such as gonorrhea, may pass into the abdominal cavity where they can become life-threatening. So the uterus is a relatively small organ, only about the size of a pear, but it's extremely strong. It's almost all smooth muscle with only a small cavity inside. The uterus is composed of 2 parts. You have the upper portion known as the body, and a lower narrow section, the cervix. Just above the level where the uterine tubes attach to the body of the uterus, it rounds out to form a bulging prominence called the fundus. Except during pregnancy, the uterus lies on the pelvic cavity just behind the urinary bladder. By the end of pregnancy, it does become large enough to extend up to the top of the abdominal cavity. And the uterus will function in 3 different processes. You have menstruation, pregnancy, and labor. The corpus luteum will stop secreting progesterone and decreases its secretion of estrogens about 10 days after your ovulation. About 3 days later, when the progesterone and estrogen concentrations in the blood are at their lowest, then your menstruation starts. Small pieces of the mucous membrane that line the uterus or the endometrium will pull loose, leaving torn blood vessels underneath. Immediately after menstruation, the endometrium starts to repair itself, and again, it will grow thick and become lavishly supplied with blood in preparation for a pregnancy. If fertilization does not take place, then the uterus again sheds the lining, made ready for a pregnancy that did not occur. Because these changes in the uterine lining continue to repeat themselves, they are referred to as the menstrual cycle. Menstruation first occurs at puberty, often around the age of 11 or 12 years of age, and normally the cycle will repeat around every 28 days for many years before it ceases at menopause. The vagina is a distendable tube about 4 inches long, made mainly of your smooth muscle and it is lined with mucous membrane. It lies in the pelvic cavity between the urinary bladder and the rectum. It is a part of the female reproductive tract that opens to the exterior. The vagina is the organ that your sperm will enter during the journey to meet an ovum, and it is also the organ from which the baby. 2 pairs of your exocrine glands will lie embedded in tissue to the left and the right of the vaginal outlet and release mucus fluid into the vestibule of the vulva. One of these small glands are called the greater vestibular glands, also known as the Bartholin's glands, and the other is the lesser vestibular glands, also known as the skin glands. Mucus from these glands may contribute to lubrication during your sexual intercourse, and the vestibular glands have clinical importance because they may become infected. So, for example, the bacteria that cause gonorrhea are often hard to eliminate once they infect a vestibular gland. The breasts will lie over the pectoral muscles and are going to be attached to them by fibrous suspensory ligament. And your breast size is going to be determined more by the amount of tissue that surrounds the glandular tissue than by the amount of glandular tissue itself. Each branch will consist of 15 to 20 divisions or lobes that are arranged radially. And above each lobe consists of several lobules, and each lobule consists of milk secreting glandular cells. The milk secreting cells are arranged in grape-like clusters of small chambers called alveoli, and each contractile cell that surrounds the alveoli and push milk into the ducts when stimulated by oxytocin is released from the posterior pituitary gland, which is a process also known as milk letdown. Small lactiferous ducts will drain the alveoli and converge towards the nipple with the spokes of a wheel, and only one lactiferous duct will lead from each lobe to an opening within the nipple. Each lactiferous duct will then widen into a lactiferous sinus just before it reaches the nipple, and the colored surface around the nipple is known as your areola. It contains many tiny bumps called areolar glands, and those are large sebaceous glands that secrete skin oils that condition the skin while nursing an infant. The areola also has a network of smooth muscles that contract to cause the nipple to become erect, which often helps in an infant to latch onto the breast at the most efficient location. Knowledge of the lymphatic drainage of the breast is important because your cancerous cells from your breast tumors often spread to other areas of the body through your lymphatic system. The external genitalia of women consists of several structures that are collectively called the vulva, and the mons pubis is a skin-covered pad of fat tissue over the symphysis pubis. Pubic hair appears on this mound of fat and skin at puberty, and it persists throughout life. Extending downward from the elevated mons pubis are the labia majora, which translates literally to large lips. These elongated folds, which are composed mainly of fat tissue and glands, are going to be covered with the pigmented skin and pubic hair on the outer surface and are smooth and free from hair on the inner surface. The labia minora are nestled medially between the labia majora and are covered with thin skin. These two small lips will join anteriorly at the midline. The space between the labia minora is the vestibule, and there are several genital structures that are located within that vestibule. The glans are the head of the clitoris, which is composed of erectile tissue that's similar found to that is found within the penis, and it's located just behind the anterior junction of the labia minora. The deeper erectile tissue of the clitoris will branch into two bulbs situated between the glans clitoris and the vaginal opening. That is going to be known as the external urethral meatus. The vaginal orifice is bordered by a thin fold of mucous membrane called the hymen, and sometimes the hymen partially blocks the vaginal opening. The ducts of the vestibular glands will open on the other side of the vaginal orifice that are medial to the labial minora. When you hear the term perineum, that is used to describe the area between the vaginal opening and the anus. And this area is sometimes cut in a surgical procedure called an episiotomy in order to prevent tearing of tissue during childbirth. Your menstrual cycle consists of many different changes within the uterus, ovaries, vagina, and breast, and then in the anterior pituitary glands, secretion of hormones. In the majority of women, these changes occur with regularity throughout the reproductive years. The first indication of changes comes with the first menstrual period, and the first menses is referred to as menarche. A typical cycle covers a period of 28 days. However, there are some cycles that can last 2 to 3 months, and then there are some that only cover 24 days. Each cycle consists of 3 different phases. These 3 periods of time in each cycle are called the menses, the proliferative phase, and the secretory phase. The menses is a period of 4 to 5 days that's characterized by your menstrual bleeding. The first day of your menstrual cycle is considered day 1 of your menstrual cycle. The proliferative phase begins after the menstrual flow ends and it lasts until ovulation. During this period, the follicles mature, the uterine lining thickens, and your estrogen secretion increases to its highest level. The secretory phase of the menstrual cycle will begin at ovulation, and it lasts until the menses begins. It is during this phase of the menstrual cycle that the uterine lining reaches its greatest thickness and the ovaries secrete its highest levels of progesterone. As a general rule, during the 30 to 40 years that a woman has periods, only 1 ovum matures each month. However, there are going to be some exceptions. Some months more than 1 will mature, and in some months you will have no ovum that matures. Ovulation occurs 14 days before the next menses. So in a 28-day cycle, this means that ovulation occurs around the 14th day of your cycle. In a 30-day cycle, however, ovulation would not occur on the 14th day, but instead it would occur on the 16th day. The time of ovulation has great practical importance because the possibility of fertilization can only occur during a short period of time during each menstrual cycle. Although a few super sperm may remain viable for up to 5 days, most sperm will retain their fertilization power for only 24 to 72 hours after being deposited into the female reproductive tract following ejaculation. The anterior pituitary gland that plays a critical role in regulating the cyclic changes that characterize the functions of the female reproductive system. So secretion of GnRH from the hypothalamus will stimulate an anterior pituitary gland to secrete both FSH and LH. From day 1 to about day 7 of the cycle, your GnRH selectively stimulates an anterior pituitary gland to secrete your increasing amounts of FSH. A high blood concentration of FSH stimulates several immature ovarian follicles to start growing and secreting estrogen. Working together, your increasing levels of estrogen and GnRH in the blood will stimulate the anterior pituitary gland to release its increasing amounts of LH. LH will cause maturing of a follicle and its ovum, ovulation, and luteinization. Ovulation cannot occur if the blood levels of FSH stay low because a high concentration of this hormone is essential to the stimulation of your ovarian follicle growth and maturation. With a low level of FSH, no follicles will start to grow, and therefore none will become mature enough to ovulate. Ovulation is going to be caused by the combined actions of FSH and LH, and then your birth control pills that contain estrogen substances suppress your FSH secretion. Therefore, it indirectly prevents your ovulation. The reproductive systems in both sexes will revolve around the production of your reproductive cells, as well as mechanisms that ensure union of these 2 cells. So the fusion of these cells will enable transfer of parental genetic information to the next generation. According to table 21-3 on page 478, you can see that men and women have similar structures to accomplish complementary functions. In addition, the female reproductive system will permit development and the birth of your offspring. So for our word roots for the female reproductive system, I think we're all pretty familiar with these. I think the only one that you probably haven't seen is the OO and then your 0040. So whenever you have the 2 O's, you literally say instead of 2. For the word roots for the uterine tubes, uterus, and the vagina, you've got your salpingo for the uterine tubes or the fallopian tubes. Metro is going to be for the uterus. Hystero is also going to be for the uterus. And then the other one that just doesn't look like it, it's a colpo for your vagina. And then you've got some here for the accessory organs. So your vulvo and epizio are for your vulva, perineo for your perineum, clitoro for your clitoris, and then your mammo and maxo for your breast. All right. So for pregnancy and birth, I'm going to go through this pretty quickly. Honestly, I'm not even going to read the script just because we don't really need to know too much about like the actual, like prenatal, postnatal, and all of those. So really the big things that we need to know for whenever it comes to coding, your prenatal period, that's going to be what begins at conception and continues until birth. So essentially that pregnancy period. Your length of pregnancy or your gestation period, that is typically about 39 weeks. It can go all the way to like 41, 42, depending on your provider and your OBGYN. All of your organ systems are going to be formed and function by your month 4 of gestation. And then from there, they are just going to have to grow as the baby grows. You don't need to know the formation of the primary germ layers and your histogenesis and all of that. I just included it in here in case you guys wanted to see them. And then your birth defects. We do have some coding that is directly related to your birth defects. So some of them can be because of genetic factors. Some of them can be because of your environmental factors. So like your radiation, chemicals, and infections. Those are typically ones that are going to be harmful during the first trimester. So that's why I always say the first trimester is very important. And then the process of birth or your parturition, that's going to end usually around the week 39 of gestation. Again, sometimes it can go as much as 42 weeks. Your muscular contractions are going to begin and your labor is initiated. That amniotic sac is going to rupture. Your cervix dilates. I'm pretty sure we all know how it all works by now because you both had kids. So I feel like I don't need to go too much into it. So your word roots are going to be amnio for your amniotic sac, embryo for embryo, feto for fetus, toco for labor, natty for birth, lacto and galacto are going to be for your milk. Gravata, that means pregnant woman, and para means woman who has given birth. So you might see those used as Gravata 3, para 2. That means that they have had 3 pregnancies, but only given birth twice. So they probably had, or they had 1 miscarriage. Any questions? Okay. Again, I'm not going to go through the growth, development, and aging because these are all, like just things that we all know. Just kind of as we grow up and get a little bit older, like your age ranges of adolescence and then your adulthood, degenerative diseases, which again, we'll get into when we start talking about coding and all of that. Your effects of aging, you've got, like your skin is going to sag as you get a little bit older. You've got thinning hair or hair loss occurs with the skeletal system. You've got like your osteoporosis, bone spurs, degenerative joint diseases, things along those lines. Your central nervous system, you have that increased risk of dementia as you get a little bit older. And then elderly individuals suffer from depression because of the changes in the nervous system as well as the changes in your hormones and your endocrine system. Cardiovascular system, the biggest things that we have to worry about are those fatty deposits within the blood vessels, and then those degenerative heart and blood vessel diseases. Your heart attacks, your strokes, your hypertension, your blood pressure, all of those kinds of things. Respiratory system, really, it's just wasting of those respiratory muscles that makes it a little bit more difficult to breathe. You've got your respiratory membrane is going to thicken, so therefore it's going to take a little bit more for that oxygen to actually absorb into the bloodstream. Your urinary system, your nephron units will decrease between ages 30 and 75. So therefore, it's just going to take a little bit more for your body to produce that urine because the blood flow is going to decrease and things along those lines. As we get older, we all know our eyes get terrible. We know that you might have glaucoma. You might have retinal degeneration or detachment, some hearing impairment, our taste buds change. We may not be able to taste as much because we really only have about 40% of the taste buds that are present at the age of 75.